I'll be talking about CUVIS. There are many robots available in the market right now, but the fact is CUVIS is the only fully automatic robot available. You can do, it's fully automatic, prior planning is done on the CT scan. It takes all the bone cuts along with tibial keel preparation. So CUVIS is simple, it's flexible, it's really safe because you have a real-time system monitoring system, and then you can achieve some millimeter dimensional accuracy, and whatever alignment you need to choose, mechanical or functional, it's your choice. So this is the process goes. The scan is done, surgical planning, it takes around hardly 15 minutes. System preparation, sterile drapes, and all those things are done. Registration, you need to mark 40 points. It takes around just 2 minutes. After the gap checking is done, the cutting starts, and then you can just export your results. In my center, I call it as a hashtag MediRobo technique, 3 Ps, personalized, precise, and painless, because I don't touch soft tissues. I'm a functional guy. So I believe in functional alignment, not in gap balancing. There's a short video. So after a CT scan is done, auto segmentation is done by the robot, you need to mark these points, femoral head center, mark the point on the 3D image, and then you can very well check in all the 4 planes. And then condylar center, medial epicondyle, you need to mark at the sulcus. For the lateral epicondyle, you have to mark at the most prominent point. Then say medial posterior condyle point, lateral posterior condyle point, middle distal condyle, and lateral distal condyle. So all these points you need to mark on the 3D image first. You can very well check in the coronal, sagittal, and the axial plane. And these should be accurate. It should be on the bone, not on air. This screen is very important. You can emphasize on the sagittal plane. Your implant should exactly match the anterior and the posterior condylar offset of the bone. And you can very well anteriorize, posteriorize, distalize the implant positioning. So here you are just planning the implant position and you are planning the cuts. All these fine changes you can do intraoperative as well. In the axial section, you can just lateralize the component. You can see the patellar tracking. So these changes you can do intraop as well, but this is really important. Now in this image, I have used size C and my posterior lateral cut is 8.3. Why? Because the implant condylar thickness is 8.2 millimeters. So I try to match it, but you can very well change intraoperative. After that, you need to mimic these points intraoperatively. So these are some points: medial point, lateral point, proximal point, anteromedial, anterolateral, and posterolateral. So these points you need to mimic intraoperatively to keep your root mean square values less than 1. Then you need to mark the tibial axis, proximal center, ankle center, tibial tuberosity, PCL fossa, medial condylar center, lateral condylar center. So after all these things are done, the tibial registration are done. Okay, so in this screen you are seeing the tibial positioning. Intentionally I have kept tibia slight anterior so that as a precautionary measure my burr should not touch the posterior soft tissues. So this you can do, and you can very well go for keel preparation by the robot, but I prefer doing it manually. So once the gap check is done, then you have this screen. We have this haptic boundary, not a haptic feedback control, but it has a yellow boundary. My robot won't go beyond that, so my soft tissues are really safe. And you can go for a full resection femur at once. But if you have a case with severe FFD, you can go for distal femur resection, tibia resection. You need to check the action gap, go ahead, and then you can go further with the cuts. So here's the intraop gap check. Now see, medial is tight both in flexion and extension. Now we have 2 options, either to go for gap balancing, release all the way to the posterior middle corner, or to go with functional alignment and keep tibia in 3 degrees of varus, increase femur rotation by 1 degree, and varus by 1 degree. Now, we have a rotating origin thing also in this. We can pin the lateral side, only median numbers will change. So in this video, you can see 11 mm gaps both in flexion and extension. I'll show the full range of motion. How beautifully the stability will be maintained. There will be equal 11 mm gaps in full range of motion. So this is how the robotic accuracy comes in picture. You don't have a mid-flexion instability because you're not releasing any soft tissue. View of my X-rays pre and post. Pre and post of X-rays. You can see how beautifully your posterior condylar offset is maintained. Thank you so much.